Hi everyone, my name is A Fulgieri, and today I'm going to be walking you through my health promotion topic, which is vaccines for the older adult patient. So starting on the first topic slide, immunization is a health promotion intervention that reduces and prevents the transmission of diseases between individuals. And we know that immunization is a primary health promotion intervention because they help to prevent disease before it ever occurs and promotes the overall health and wellness of the individual. One important distinction that I wanted to make while covering this topic was that between the terms immunization and vaccine, because I think they're used pretty interchangeably. Immunization is the actual physiological process by which a person develops immunity, and the vaccine is the product itself that we're administering to a patient to develop immunity. So like I said, I think they're used pretty interchangeably, but as nurses, it's important that we understand the distinction between the two, so we're careful in how we use those words when we're teaching a patient. Moving on to the second topic slide. The development of immunity against a variety of diseases is a constant and lifelong process. So even though immunizations are something that we initiate in childhood, it doesn't mean that it should stop at any point. And we can contribute this to a couple of different factors. The first being that the risk for vaccine preventable diseases can change over time. So this might be a result of age, job, lifestyle, travel experiences, or health conditions. The other important consideration is that protection, once provided by vaccines that were given as a child, have the potential to wear off over time. So just because we gave a vaccine to the individual when they were young doesn't mean that that immunity has been sustained for long enough, and that individual might later on become susceptible to a disease that they once were immune to. And then lastly, we have to consider changes to the disease itself. So the most prominent example of this being the seasonal influenza vaccines that come out, because every year we know that the flu virus itself changes a little bit. So we want to make sure that we give our patients the most up-to-date immunity, if you will. And then another important point that I wanted to hit on is the fact that immunity, or lack thereof, is a critical component in understanding the health of an individual, regardless of age or circumstance, is what makes immunization an important consideration for nurses across all realms of healthcare. So it doesn't matter what area of nursing you might go into or what specialty you might decide to work in. Immunization and the kinds of diseases that your patient might be susceptible to are going to be something that you will need to consider in order to give the most complete care. Moving on to our learners. So the target population of this presentation or this information will be the older adult patient, so those aged 65 years and older. Vaccines are especially important to maintain the health of this population because their generally weaker immune systems may make it more difficult for them to ward off infections. And the ones that we worry about in particular are going to be influenza, pneumonia, shingles, and their associated complications, which might include things like long-term illness, hospitalization, or death. Moving on to the second learner slide. There's 3 vaccines in particular which target diseases that we are concerned about with the older adult patient, and those are Prevnar 13, Pneumovax 23, and Shingrix. So Prevnar 13 is a pneumococcal conjugate vaccine. It is 1 dose that's given after the age of 65. And the 13 in Prevnar 13 just refers to the number of strains of pneumococcal pneumonia that the vaccine covers. In other words, it is a 13-valent vaccine, so you might hear that said as well. And then the same thing goes for the 23 and Pneumovax 23. Pneumovax 23 is a pneumococcal polysaccharide vaccine. It is 1 dose that's given after the age of 65, at least 1 year after Prevnar 13 when both vaccines are indicated. And then lastly, we have Shingrix, which is the zoster recombinant vaccine. It is 2 doses given between 2 and 6 months apart. And herpes zoster actually is the virus that we are concerned about. That's the one that causes shingles. Moving on to our nursing diagnosis. The nursing diagnosis that I would choose for this population is readiness for enhanced health literacy related to immunizations as evidenced by an expressed desire to enhance understanding of health information, to make choices regarding his or her health care. So this nursing diagnosis would pertain to the older adult patient who has questions about immunizations and specific vaccines for themselves. And with the experiences that I've personally had with older adult patients, I feel like this is becoming more and more prominent because with the increasing availability that we have to information, so increases the number of older adult patients that are actively participating in their own healthcare by self-educating. They're going online and they're reading about things like medications and procedures, preventative measures, and vaccines, and they have questions about that. Moving on to a SMART goal. One SMART goal that might pertain to this population would be patient will verbalize 2 specific reasons why immunizations remain a relevant health promotion intervention after age 65 by the end of the teaching session. So an example of something you might want to hear would be immunization with Prevnar 13 and Pneumovax 23 can provide me protection against pneumococcal pneumonia and prevent the spread of disease to my immunocompromised spouse. And then on the right, I've included an image of a very interesting CDC campaign that reinforces the importance of vaccination by relating the information back to personal experiences the patient might have had. So this one in particular says, I watched my sister suffer with shingles. That's why I made sure we both got vaccinated. So just a means of reinforcing the teaching by relating it back to personal experiences. And I'll come back to that in a little bit too. Moving on to the teaching outline, the first thing that we're going to want to do when we're teaching the older adult patient is to assess their baseline level of knowledge. And this might be as simple as starting off by saying, tell me what you already know about being vaccinated after the age of 65. And in so doing, the nurse is able to identify where gaps in the patient's current knowledge may exist. But it also helps the older adult patient to avoid feeling patronized. If the nurse intends to teach information that he or she already feels like they have a solid understanding of, we can avoid them feeling like they're being talked down to, or avoid making it seem like we have all the information and they don't know anything. So we should start with the assessment of baseline knowledge, and then we can also do things like identify and consider factors that may be affecting that patient's levels of health literacy. And some contributing factors might be things like culture and educational background and cognitive function. So those are all things that we should also be wary of when we're teaching the older adult patient. Moving on to the second teaching outline and demonstration slide. Once we've done that, we can start explaining the process of immunization, but we should do so in simple terms that the patient is able to understand. So what I've included is just a simple template for what that conversation might look like. So you could say things like, a vaccine contains a small piece of a particular pathogen. When it's given to you by a vaccine, your immune system recognizes the piece of pathogen as a foreign object and mobilizes a response to destroy it. The immune system then becomes trained to recognize that pathogen as a threat to the body, and should your body ever encounter that same pathogen in the future, the immune system has already learned how to handle it before significant damage can be done. So something along those lines, but just keeping it very straightforward and explaining the process in a way that is going to be easy for them to understand. Moving on to the third teaching outline and demonstration slide. Once a general understanding of how immunization works has been established, we can move on to providing some potential benefits of being vaccinated. And those might be things like, obviously the decreased risk of developing diseases such as pneumococcal pneumonia, shingles, or influenza, as well as we talked about before, the associated complications of those illnesses, long-term illness, hospitalization, or death. But then lastly, what I think might be the most important potential benefit to share with the older adult patient is the decreased risk of transmitting those diseases to the people that the patient comes into contact with. So that might be, if they have an immunocompromised spouse, or to young grandchildren, or a newborn grandchild, or, friends that are undergoing chemotherapy. I think that can be a very important point for the older adult patient, is who else that they are close to that they're protecting. Moving on to evaluation, we know that the teach-back method is a very effective means of evaluating patient understanding of a topic. It's associated with improved patient outcomes, safer care and adherence, fewer calls by the patient, to the office to have things re-explained to them, as well as improved patient and clinician satisfaction. So questions that you might want to ask when you're evaluating the older adult patient on this topic would be things like, based on your age, can you give me an example of a vaccine you might be a good candidate for? Or you could say, other than yourself, who might benefit from you receiving a vaccine? And then something else that we can do in evaluation, as well as a means to really reinforce the teaching, is to relate the information presented back to a personal experience of the patient. So like we saw with the CDC campaign poster, relating it back to personal experiences in which the patient might have seen a friend or family member suffer with the disease that we want to vaccinate them against. Moving on to follow-up. Follow-up care by the nurse should include contacting the patient to see if he or she followed through with receiving the recommended vaccines. And this is important because some insurance companies actually dictate that their patients receive vaccines at their pharmacy rather than in the provider's office. And so if a patient leaves the office, goes to get a vaccine at their pharmacy, but never communicates that information back to the provider's office, you might start to develop some discrepancies in their medical record. And follow-up might not even necessarily mean like calling the patient to follow up with them, but maybe just asking them, at the beginning of their office visits, if they've had any recent vaccines or if they had any vaccines in the time between office visits. Lastly, we're going to touch on some resources for the patient. So one important resource for the older adult patient who might be receiving vaccines is their local pharmacy. Because like I said, a lot of insurance companies are now requiring that people go to the pharmacy to get their vaccines. But what makes the pharmacy a good resource is the pharmacist, who is going to have the knowledge regarding the vaccines that they could be giving, risks, benefits, side effects, actually, Prevnar 13, Pneumovax 23, and Shingrix are all common vaccines given at pharmacies. So the contact information that I have provided was just to the Walgreens that was closest to CNM. It's at 2950 Central Ave Northeast. But it doesn't have to be any one particular pharmacy. It's just whatever pharmacy the patient feels most comfortable going to. And then lastly, we have the New Mexico Department of Health. There are public health offices. They're scattered throughout New Mexico, but these are an important resource for the patient because individuals can go here to obtain their immunization records for either themselves or their children. So this might be an important resource for the older adult patient who has no idea what vaccines they've had in the past and what they might not have any immunity to. So the one that I picked was just one that's here in Albuquerque that seemed to have the most comprehensive availability of resources, and that one's at 2400 Wellesley Drive Northeast, and their contact information is provided. So that is everything. I appreciate your time, and I look forward to being back in the classroom soon. Thanks.